My name is Peter Stanton. I'm the publisher of the Worcester Business Journal. It's my pleasure to welcome you here this morning to our fourth annual breakfast series on the state of the state in healthcare. Events like this are only possible when we get the support of the community, and that support comes from our presenting sponsors, Fallon Health and Reliant Medical Group, and our event supporters, the HRMA, the Human Resources Management Association of Central Mass, Conover and Gould Strategic Communications, and our media partners this year are Charter Channel 3. It's my pleasure to introduce our keynote speaker, Delia Vetter from EMC, who's their Senior Director of Benefits and Programs. Since joining EMC in 1994, Delia has helped build a nationally recognized comprehensive benefits program at the company, focused on cost effectiveness, innovation technologies, and health programs. The plan uses technology tools to manage employees' healthcare and healthcare dollars and to effect behavior modifications to the tune of millions of dollars in savings for EMC and its employees over the last decade. Under Delia's leadership, EMC was the first employer to provide an employer-sponsored e-personal health record, and the company's been recognized with the 2013 Lifetime Achievement Award and 6 Best Practice Awards from the New England Employees Benefits Council, as well as numerous other national and regional recognitions, many of which are listed in the program. Delia serves on several boards of trustees, including the Milford Regional Medical Center, the Mass Hospital Association, New England Health Institute, New England Employees Benefits Council, and she is on the Advisory Council for the Pioneer Health Institute. Delia is a sought-after healthcare expert, and this morning we're going to be the beneficiaries of her expertise as her talk is on developing your company's healthcare strategy. Delia, the podium is all yours.
Thank you, that was a great introduction. Well, everyone, I guess we're all here because we all love healthcare, right? I know I do, and I've been in healthcare, or in benefits, which today is really healthcare, for almost 30 years, and 21 of those years at EMC. So I've had an opportunity, just like many of you, to experience many different changes in the healthcare environment. And one of the things that's exciting today is that it's different. It's different than it was 10 years ago, and it's going to be different in the next 10 years and 10 years after that. And the opportunity that we all have collectively to make that change, I hope you all realize, is really important to developing the next era of healthcare. And so, it's interesting, when I titled my presentation, How We Got to Now. And the next 20 minutes, I'm going to focus on our journey over the past 14 years of how we got to now. But I'll tell you how I came up with the title, How We Got to Now. Thinking about, what should be the title for my presentation. And I recently read a book. It was called How We Got to Now by Stephen Johnson. And it's the 6 innovations that make the modern world. Although it's not about healthcare, but it does provoke thought in what you can do, what you do today that you think might be insignificant, how 1,000 innovations on top of that will create yet the next modern world. So what do you think that the 6 innovations that created the modern world are? Glass, cold, clean, light, time, and sound. Okay? Nothing that you would think of. Okay? But each one of those is what's created the modern world today. And so as I think about what we've done as an organization and what you might be thinking about doing is going to create the next modern world of healthcare within the healthcare community. So the strategy for us was the year 2000. In 2000, if you remember, the healthcare cost crisis, lots was going on. The bust of the .com and many things were just happening around us. And we needed a different approach to managing costs. And we really thought about at the time, our costs were increasing double digits. We had great relationships with our partners, with our vendors, with our health plans, but employees were driving cost. And one of the things that we were very sheltered from was understanding the healthcare marketplace, okay? So the first step in our 6-step program here to creating the next modern world for us, or to getting till now, was to get out of our office and go out and learn about the healthcare marketplace. So many of us, and we still do today to some degree, but all of us historically have really relied on our consulting partners and our health plans to guide us and give us information and insight into the healthcare marketplace. And that's absolutely a great thing to do. And they are very insightful and they have a whole different perspective. And so both as a resource is absolutely critical to building your strategy. But what you need to do is to go out and learn on your own. And so at EMC, we were given the opportunity to go out to the healthcare marketplace and just learn about the challenges at the provider level, at the hospital level, other employers, the political arena, the healthcare policy, because we were very sheltered, and while we were thinking about how do we design benefit programs, we weren't thinking about what's driving, what's the root cause of driving healthcare cost. So improving our knowledge of the healthcare marketplace was step one. So now, when you do that, and you come back in, and you're sitting with your leadership, and you're talking about something different than how do we design a health plan, but you're talking about as an industry expert, it gives you credibility. So now you're building credibility with your leadership because you're talking about something that they might be reading in the Wall Street Journal or on the Globe, right? And then you go out and you meet all of these experts. Now you created a network, right? And so, as you're thinking about developing your strategy and bringing credibility to what you're about to propose to your senior leadership, bring in those friends that you made, right? Because they just add credibility, again, to what you're currently stating. So it's all about it's branding yourself, your credibility, and bringing in knowledge from the healthcare marketplace and bringing in the right experts to help you sell that vision. And then, of course, thinking long term, because it's easy to think, well, what should we do next year for healthcare? We do a little tweaks, but that doesn't work, right? Because healthcare costs continue to increase in the market, and it's very dynamic and it's very fragmented, and there's so many things going on. You really need to think about something in a very long term. So that's what we did. We thought about a strategy in the long term. We looked 5 years out. And then within that strategy, the consumer is at the center of that strategy because it's all about them, right? Healthcare cost, the equation for healthcare cost is pretty simple. It's unit price times utilization, right? That's it. And you can impact unit price by negotiating and so forth. And utilization is a little bit more difficult to manage, but you can do that as well through education. So the consumer is driving costs in regards to their lifestyle behaviors as well as utilization. So that's the other thing that we thought about as we develop our strategy is consumers have to be at the center of it. And then develop partnerships and collaborations. So we were very successful at doing that. So prior to 2000, we looked at our health plans as a vendor, right? When we started to talk about and develop our strategy, it's really a partnership and collaboration, right? You want your health plan to be part of your strategy, to help you develop your strategy, to give you the insights, to provide you with a path. Maybe it's a different path than what you're thinking of taking, or if you're thinking about taking a different path, that they can support that path. So that collaboration is extremely important in those partnerships. So we moved from vendor to partners, and everyone is our partner. And then optimize data and technology. So in 2000, data today is such a used terminology, but back in 2000, when you talked about data, people didn't really understand what they could do with data. There had been so many failures with data in the data warehouse environment because we couldn't understand how we could optimize that data and leverage the data. So optimizing data and technology and integrating both to drive the right behaviors and to drive the right success. And then the last one is bottom-up approach, right? So all of us here that are kind of in management or leading a strategy, you never want the CEO or your boss or finance to say, look, you have to shave $20 million from the healthcare, because now you're reacting and you're doing things that are not long-term. You're focus on quick actions to save that 20 million. So driving a strategy from the bottom up where you're bringing the problem to your leadership. And at EMC, that's exactly what we did. We brought the problem to the chairman of the board. That's where we started, and began the education process all the way through. So driving the strategy bottom up, because it gives you much more leverage to think about and put together a comprehensive strategy versus just reacting. And so for us, as you know, you can't improve what you can't measure. So when we developed our strategy, there were a few components that we needed to include. One, which was data, understanding the health of your population. And we had very fragmented data points. We had many health plans throughout the US. I think we had 30, and very fragmented data points. And we needed to bring in data together so that we could look at it, analyze the data, and look at it much more collectively, and then develop our approach based on data. We also, at the time, had very arbitrary wellness programs. They weren't really delivered from HR. They were delivered from the line organizations, and we couldn't measure them because there was no way to measure the success of the programs because we didn't have data tied to the programs. And then, of course, we had a very, very limited knowledge of the healthcare delivery system and the economic environment and healthcare policy. And so we lacked a very unified approach to drive business results. So developing a strategy is driving business results for your company. And it's the sustainability of your company is based on those business results and getting everyone involved. So employees are also part of driving sustainability and business results. In developing a program, so now you've gone out to the marketplace, you've gathered your knowledge, you understand that you want a long-term vision, you know that some of the basics are you need data and technology to drive your strategy and to complement your strategy. Then there's some guiding principles that you have to think about. And for us, the guiding principles for our strategy was to maintain competitive programs. So, and that's why it was important to us to not shift costs to employees, because we in the tech industry really need to be competitive because we're a multinational company, and then within the United States we're competing with the Googles and the Amazons and so forth. So maintaining a competitive program is important, and offering choice because we know that employees like choice. Distribute the cost more equitably to minimize the impact to the majority. So we looked at, in developing the strategy, of changing copays, but our strategy wasn't based on changing copays, but we needed to align with what the marketplace was doing. So we did that once, and that was in 2005, and then we didn't do it again. But we wanted to make sure that the costs were distributed equitably. Promote consumerism. That was extremely important to help employees understand that they're part of what creates the healthcare environment of today, and help them to understand the healthcare environment. And then, of course, that we were, as a company, going to influence the healthcare marketplace by getting involved in organizations in the industry. So how do you do that? So now you have your guiding principles, and how do you drive it from the bottom up? Well, so data becomes important. So understanding your cost driver is key to developing your strategy. So for us, back in 2000, we clearly understood that 15% of our population was driving 75% of the cost. So there's your opportunity. So you need to stratify your population, working with your health plans, working with your consulting partners, stratify the population so that when you're sitting with your leadership and talking about why we need to take a different approach, you have the data available. And this, for us, became a very powerful slide. And so you're sitting with your leadership, and they said, okay, well, this is all great, but why? Because you're asking for investment. You need to invest in data and technologies and programs. And they'll ask, well, why should I? What's the return on investment? And what I always say is, what's the cost of doing nothing? So doing the analysis and looking at the cost of doing nothing would mean that costs would double in 5 years. There's your ROI. Because every finance organization wants that ROI right up front. They want to know the numbers. But I have to look at it much more long term. And the cost of doing nothing for us was doubling cost. And it's not just doubling cost for the company, it's doubling cost for our employees as well. Because employees pay a portion of that in the form of copays, deductibles, as well as employee contributions. And that's a really important factor, because when you're educating your employees and when you're rolling out a strategy, they need to understand that they're part of that problem as well, and then they can be part of that solution, and that everyone collectively doing the right things and being good consumers and smart consumers and changing lifestyle, that it contributes to the bottom line. One of the aha moments for our employees was when we developed our strategy and we rolled it out. And we rolled it out as a 5-year plan, right? So that's absolutely important for your population to understand this isn't a one-time thing, this is a 5-year plan. And we held meetings throughout EMC. I think we covered probably about 80% of employees. And as I mentioned, we started from the top, the chairman of the board, to the CEO, to EVPs, to VPs, and we went all the way down to employees, and we educated them about the healthcare marketplace. We went out, we collected the data, and then we came back in, we educated them so that they could understand what the next 5 years would look like and why it would look the way that we were describing it. So education is key, because you need the education to your leadership so that you can get support, because when you get down to the employee population, they're not very nice. When you're standing there and you're telling and you need that support. And so gaining support from the top down is important. And so for our employees, when we held meetings and we talked about, so what do you think healthcare cost? Well, I don't know, $5, because that's what I pay, right? And it's not $5, it's say $100. And who do you think pays that bill? Insurance company, they got lots of money, right? We've all heard this. The aha moment is when you say, it's not the insurance company. It's not the Blues or the Harvards or the Tufts or the Fallons, okay? Because in a large organization like we are at EMC, we are self-insured. And that's EMC's money, that is shareholder money, that is your money that's paying for this bill. So it's not, and believe it or not, there was a moment that I think they were a bit shocked and a little bit concerned, especially at the time when our stock price and when our stock price was declining, and we tried to paint the entire picture about everything that we do contributes to shareholder value and contributes to our revenue and contributes to our cost. So in our quest to educate our employees' population, it was business. It wasn't about benefits, it was about business. How do we continue to sustain the business and offer health care at a competitive and reasonable cost that's affordable to everyone, while maintaining, of course, choice. And then we also started to think about, we're developing our strategy, and so what's ahead? In the next 10 years, what are we going to be faced with? And this was thinking back in the year 2000. So we were talking about the designer types of drugs, all of the blockbuster drugs in the marketplace today and have been over the past decade. and then the technology that increases healthcare costs, and genetic engineering and genomics and lifestyle enhancement drugs. These are all of the things that in 2000 our costs were pretty significant. But then as we looked out 10 years, that was part of our consideration in building our strategy. It's not just what's it like today, but what's it going to be like in 10 years. So really being looking forward and looking at the additional costs and what the environment would bring. In our communications, I touched a little bit already on this. To our employees, it was tell it like it is, right? Everyone is part of this problem. We can all be part of the solution. We talked about the healthcare landscape. And then we defined the strategy and the role. So we didn't just roll out a strategy and say, here it is. We defined everyone's roles, the leadership role, the management role, and the role of the employee. And the message has to be, we're investing in our business. We're investing in you, our employees. We're investing in your health. And doing the right things is going to pay benefits, and it's part of our business sustainability. So when we rolled out our strategy, it was, as I mentioned, long-term vision, and every employee at EMC understood that it was the vision was to accelerate adoption of consumerism by helping employees and family members take better care of themselves through meaningful data, right? We promised them that every program at EMC would be very deliberate and meaningful based on data. Okay. That was a little frightening to employees initially, because once they understood that we were not we, but through a third party collecting data, some privacy issues, and there was some concerns that surfaced. But because our leadership had already weighed in, we had buy-in from our leadership, we were able to manage those concerns. So when an employee called legal, or they called my boss, or they might have called Joe Tucci's office, hey, I understand that my data is in the data repository and I don't want it there. So the message was pretty clear that this was the strategy. So that's the important thing about getting the buy-in. And then to create a connected healthcare system, and to be active in the marketplace, and to be part of creating change, and to accelerate the adoption of healthcare or consumer technologies. And so our approach, when we developed our strategy, taking everything into consideration, our guiding principles using technology and data, was to create an integrated approach with data and a technology that was a smart technology that shared the data back and forth, and it created a personalized environment for the individual, right? So now that's part of gaining some momentum for the individual to engage, because it's about them. So this integrated approach is what we proposed to our leadership. It didn't exist. We were the first to integrate this type of environment. And when we talked about it early on out in the healthcare marketplace at industry forums, there's a lot of concerns about whether or not this would work, and how employees might feel about their data being shared or being in a data repository. But as I mentioned, we worked through that. And what this environment provided us was the ability to look at the data on a regular basis and understand the health of our population. That was our business intelligence. And then to drive the right programs that are targeted to the conditions of our population, or the lifestyle behaviors, and then drive the right programs and the right messaging to help them to change their behavior and to engage much more in the chronic disease type of management. Although there are disease management programs within the health plans, and they work extremely well, but we need to reinforce that internally, right? That it's much more part of a bigger picture versus just the health plan reaching out to the employees that they want them to go into a disease management program. So a unified and cohesive strategy is absolutely what will get engagement. And then data, right? So data is at the heart of our strategy. And early on, we learned that we had fragmented data and we needed to do something different. So we did something different. Now, we asked our executives for funding for our strategy to put together this integrated approach. It does take resources, and it does take financial capital. okay? But what we promised is that we would deliver results and that we would deliver ongoing metrics. So through this environment and through our consulting partner, we were able to provide what we call a dashboard. So every quarter, our leadership receives this dashboard, and it's chock full of information. The dashboard provides 3 years of healthcare cost total, broken down by member, by health plan, by hospital or health system. So the how much employees are paying out of pocket versus what EMC is paying out of pocket. The top 10 conditions that we see within the population, the top 10 drugs, utilization of generic drugs versus brand. So all of this type of data that helps us to understand what's going on a quarterly basis within our environment. So in a strategy, in a healthcare strategy, a data strategy is extremely important because this is what's going to drive not only the program, but this is what's going to drive continued engagement and ability to measure. We also now measure the employees' wellness programs because we have many types of programs, again, based on the data that we see that's relevant to our employee population. And one of the questions always from finance and our leadership is, well, how do I know things are working? How, show me what your metrics are. And so now with this data environment, we're able to measure programs as well. And then what our leadership really likes is that we can give them really quick key observations in a one page, right? So if you imagine your leadership, might be traveling, might be sitting here today next to someone, and someone says, oh, what are your healthcare costs? Oh, they're X. And he or she can pull out this dashboard and talk about it in detail, exactly what's going on in the environment. So that's getting your leadership to buy in is not an easy task, but once they do and you're able to provide value back, then it becomes an easier task. And another thing that I've learned through this process is that engage, bring to the table all of the folks that you need to support your strategy, right? Not just your leadership, but procurement, right? If you're working with your procurement, legal, because if you're doing something different, you need that, legal to be part of it. Anyone that touches anything that you do, bring them to the table, because if they are part of the process, they're going to support the process. If they're not part of the process, then you run into barriers. So in the developing of a strategy, so it was a healthcare strategy. It was not a benefit strategy, okay? It was a data strategy and an integration of technology. That was the cost containment strategy. Selling it from the top down, being smart about the healthcare marketplace, getting educated, getting involvement, telling employees like it is, getting everyone involved in creating this environment, driving a meaningful and relevant programs, and creating enthusiasm. So what does that mean at the end of 10 or 12 years? In cost containment, it means over $500 million, right? So our trend, we have programs that have been measured on an individual basis, but looking at this in total, our trend versus the healthcare, the national trend, so the delta of that is $500 million without cost shifting. Early on, I'd mentioned that we changed copays in 2004 and 2005. And that was the last time that we changed copays or deductibles. We did offer HSA, but we have very few people in that plan. So we haven't made any significant financial changes to employees. As a matter of fact, employee contributions have increased over the past 10 to 12 years in the range of 4 to 5%. And 2 years ago, it was 0%. So getting that engagement and getting employees to understand why costs are low at EMC actually creates more momentum for the population. And we tell them that we've had successful years and this is why, and these are the savings. So over $500 million in cost avoidance. Back to the original slide that we had showed our leadership the cost of doing nothing, our costs will double. Okay, so now we can proudly say that we've had cost containment. And as I wrap up, I wanted to give you a little bit of takeaways. It's difficult to sell a strategy. It's difficult to develop a strategy that's non-traditional, right? Because this was very non-traditional, and I can't stress enough the importance of getting all of your partners and collaborators together to create this environment. There's so much that they can help you with, and especially today. How many of you work with PBMs today? A lot of you, okay? You know what? Go talk to your PBM. Go talk to the leadership of your PBM and see how much they've changed. You might still think of your PBM as someone that just dispenses and processes pills. They're not, right? And how do we know that? Because we're out talking to them. We're out talking not just to our account person who brings extreme value, but we talk to their leadership. What's their vision for the next 5 years? What are they thinking about? And if you go out and you talk to your PBM, you will see, depending on the PBM, that their model is changing. That's just one example. Their model is changing to more of a healthcare company than just a dispensing company. So that's one. So go talk to them. Get your leadership together with their leadership and start to think about ways to tackle this healthcare crisis together. In Massachusetts, oh my God, the opportunities are unbelievable. And I'll tell you what, any CEO of any hospital that you called and you said, gee, I'd like to bring my leadership in, could be your executive vice president, could be your CEO, whomever that might be, just to chat with you. What's going on in the healthcare marketplace? What are your challenges, daily challenges? Do we have an opportunity as an employer to collaborate? What's our opportunity? So that's extremely important to have these discussions, because you'll learn a lot. You'll also learn that there's opportunities to collaborate and do things together. Joslin Diabetes Center was one of many that we talked to, but we were able to put together a program, a first of its kind program for EMC employees that was very intensive for diabetes management, bringing Joslin to Hopkinton, because people don't usually like to drive to Boston, right? So you got to think creatively, and again, talk to leaderships of hospital systems, health plans, anyone and everyone that's in healthcare. And that's about getting involved. Leverage data, right? Understand the data. So when you're talking to your leadership, you know exactly what you're talking about, and you have the numbers and you're crisp with the data. And of course, partner with anyone that's going to touch your strategy. And I think it's very important that you're all developing and you're all innovating and you're doing great things within your companies, is to go out and talk about them, right? And brand your company and go out and get involved. And if you're in a conversation with someone, you're talking about what you're doing at your company, it's going to be unique. Chances are it's going to be unique. So that's really important. And what does that do? It's a small world, right? So one of your executives will be somewhere and someone will say, oh yes, I was talking to so-and-so and they said X about something that you're doing, right? And that's part of the branding process of creating that credibility and creating a unified strategic long-term approach to help population health management containing healthcare costs, using different approaches than what you would traditionally use. And that concludes my talk.
Thank you, Julia. I'm Rick Saya. I'm the editor of the Worcester Business Journal. I'll be moderating the panel discussion. First, I'd like to introduce the panelists one by one. If you could please just come up. I'd like to introduce first Steve Carey, who's the Vice President of Human Resources at Polar Beverages. He has been with Polar since 1998. He's responsible for HR for 3 manufacturing plants. Polar Adirondack Beverages have a total of 1,400 employees. He's been a change agent, making progressive changes in areas of benefit administration and employee relations. He holds undergraduate and graduate degrees from Anna Maria College. Next, I'd like to introduce Jane Fontaine. the Vice President of Human Resources at Digital Federal Credit Union based in Marlboro. Since she joined the credit union last year, she has brought extensive human resources and management experience to the credit union. She earned a bachelor's degree in business administration and a Master of Science in Management from Johnson & Wales University in Providence. And she also holds a Master in Health Administration from St. Joseph's College in Standish, Maine. Next, I'd like to introduce Dave Prizik, the Senior Vice President and Chief Sales Officer at Fallon Health. He's a 22-year veteran of the health insurance industry. He lives in Worcester. Prior to joining Fallon, he held several leadership positions in healthcare organizations across the country. He holds an MBA in healthcare management from Canisius College and an undergraduate degree in marketing and management from St. Bonaventure. Finally, I'd like to call up Dr. Michael Sheehy, the acting Chief Medical Officer of Reliant Medical Group. He first began his career as a primary care physician at Reliant Medical in Leominster in 1990, later transitioned to a number of key administrative roles. He earned his medical degree from BU's School of Medicine and performed his internship and residency in internal medicine at Miriam Hospital and Brown University in Providence, Rhode Island. The panel. And now the interrogation. I'd like to direct this first question to Steve and Jane. You administer healthcare benefits for hundreds of employees. What elements of your plans or HR practices are really working for you that can also scale for smaller businesses?
Well, at Polar, first question, I need people to raise your hands. How many people have 1 to 100 employees in their companies? Can you raise your hands? 100 to 200, 200 to 300. All right, so what I'm going to do is try to stay within Massachusetts, because at Polar, we have 6 different plans. We have 6 different plans, but in Mass, I'm going to stay within Mass, so maybe everybody could try to get the feel of what we're doing in Massachusetts. We have a tier program, a 3-tier program that we brought on board 4 years ago. We went from a PPO to a tier program, so the employees, when we had the PPO, had their choice. They could go any place they wanted to go, any doctor, any specialist. So when we brought the tier program in, we had to educate. And to Delia's point, it is the company's responsibility to educate your employees. It's not Fallon. It's not UMass. It's not your doctor's offices to see when your employees walk into the office to know your plan. It's the employee and the employer's responsibility to know when you walk into the office. We also have a concierge service for our employees for health care. And some people look at me, you have that? It is for health care only. What this person does, she'll schedule doctors. She'll find you a doctor. She'll find you a specialist. We have people who have billing problems, and granted, Fallon, Reliant, UMass, they're not perfect on billing. So we have people come in with billing problems. We'll go back and have the doctors or the hospital rebill the bill because it's been billed incorrectly. So these are some of the programs that we have put in place. We have this person in our place physically now. We started off at 20 hours. It's 8 hours a week. She has her own email. She has a phone number so the employees can call and ask questions, set up appointments. And this is how we've gone through to try to educate our employees also. Every year we have meetings for changes in the healthcare, changes in the hospitals that we're using or they can use. So let's just say if you go to an enhanced hospital, it's low cost, high quality. You will not have a deductible. You might have, if you have a hospital visit you have to stay, the most you'll pay is $150. If you go to a high basic hospital, you will have a $2,000 deductible plus a $1,000 inpatient copay. And that inpatient copay is charged every time you are admitted to the hospital. So as we go along every year, it is an educational part on Polar's bottom line because we pay the premiums, but they also have an employee copay.
Well, at DCU's culture has always been very pro-employee. You know, people come first, make a difference, do the right thing. And our benefits package really shows that in our health plan. we only offer one plan, but what we've really noticed is we're beginning to look at our employee population. What someone, a 20-year-old male, needs for health insurance is not the same as some of our other employees. So we're starting to look at our population as we're planning for next year and beyond to really meet the needs of our employees. So under that vein, we're looking at offering different plans, maybe a higher deductible plan for someone, think about a 20-year-old. Our average age at DCU is around 35 years old. We hire lots of young people who maybe go to the doctor once a year, maybe never go to the doctor. So we're looking at our plan design, how we can meet those needs. We are working very, very closely with our broker, and I know Delia mentioned with our partners, it's an invaluable relationship, helping us look at the trends in our organization, what we can offer to continue to be an employer of choice and meet those needs. Working closely with our wellness program, DCU, at both locations. We have a fitness center that is subsidized heavily by DCU, and working with them closely to offer programs to our employees, offering free personal trainers, working closely with our staff in our cafeteria, to offer healthy choices, simple changes like that, and educating our employees is so important. Because I was talking to Steve when we were sitting at the table, if it doesn't affect their pocketbook, it doesn't mean anything to them. You can tell them all about costs, but if it doesn't come down to seeing how they are affecting cost, it doesn't change anything. So lots of education. Unlike Polar, most of the programs at DCU are voluntary in nature. We do offer a wellness fair. We're going to be doing a holistic wellness fair in the fall. They are voluntary. We encourage employees, with some incentives to get involved with that. We are looking at some incentives to get employees to do their annual physical, or maybe some diagnostic things. It doesn't have to be huge, it might just be enter into gift cards, just to get people aware of wellness. We send out monthly newsletters about health and wellness, and I know that, not every organization in this room has the budget that DCU has, but there are small, simple ways that DCU has been able to affect healthcare costs.
I'd like to open this up to the entire panel. Most of the employers here, after Steve's question, are smaller employers, and smaller employers don't have the resources to implement a program that a larger business would. What would you suggest small employers can do to preach that message to their employees about better health, making better choices, especially as a way to keep insurance costs down?
Yeah, I can kind of start with that. What I would recommend is lean on your insurance company and lean on your broker. We have a whole host of products that are available on the health and wellness front. On the ladder of trust, health insurance companies aren't at the top. So when we go out and talk to people about this, sometimes we're met with some level of resistance. And I think, Delia, you mentioned it about cohesion and support. As an employer, we need your help. And I'll give you a little bit of a story, the tale of kind of two companies as it relates to one of the wellness programs. We have something called the Healthy Health Plan. We actually pay people money to take a risk questionnaire, if you will, and engage with our system. The folks at Reliant got behind it and got 50% of their employees to participate in this program. They can sign up for coaching classes. It really gives them kind of an understanding of what they're struggling with from a medical perspective. And on average, we get about 17 or 18%. So that just gives you kind of one idea on how you can drive better results by just participating in the overall programs and supporting the things that not only your insurance company makes available to you, but that your broker may make available to you.
Thanks, Dave. Mike?
Yeah, I would agree. Leverage your payers for the small
Bad
employers.
word, leverage.
No, I like that. But as an example, many of the payers do have infrastructure like complex case managers that can identify. In fact, data is key, and that's where the payers can come in as well. They often can identify your employees with chronic illnesses that their case managers can do outreach with. We'll also, for example, go into some of the workplaces and do some lunch and learn sessions with some subject matter experts, bring in, for example, our nutritionist to teach about diabetic eating and stress management. So we have some of those programs as provider groups as well. But I think leaning a bit on the payers for the data and to do outreach with folks with chronic illnesses.
What about programs like that? Are they popular with small companies?
Well, I know they're popular at DCU. Anything for free is popular. But yeah, it does encourage staff to get involved. You'd be surprised what a $20 gift card will do. But as was mentioned, those lunch and learn programs are really very inexpensive. We get them certainly from our providers, but we work with our EAP. They have some great resources to bring people in for health-related topics or mental health-related topics. Very inexpensive. Many times it's included in your program.
Dave, you brought up the topic. I'm sorry, somebody had it. Okay.
One other thing on the competition is a wonderful thing. We put together a road bowl with the local colleges a few years back and had it run for a number of years. And it was basically a walking program. And it was amazing what a little competition can do, right? And whether or not it's for a gift card or whether just pride, right? Either interdepartmentally, college versus college, business versus business. Again, you don't have to have 5,000 employees to do these sorts of things, right? These programs are out there. Make good use of them.
Dave, you brought up brokers. And I'd like to direct this question to you, Dave, then Jane and Steve as well. Brokers can have an active role in helping to design a plan with several smart options. How can the insurance plan or broker help their small business clients keep down costs?
Well, certainly, I have found that the partnership with the broker is so essential. They are able to see the big picture. They help you analyze that data that you're getting, looking to where all the dollars are being spent. For instance, maybe you're looking at your pharmacy cost and seeing what medications are being utilized, focusing on, okay, do we have a lot of people taking, I don't know, diabetes medication, and focusing on educating people on that, looking at different plan designs based on your employee population, what might be meeting the needs of employees while keeping costs down. So if getting a good broker, if you don't have one, is so important because they are so full of knowledge.
I agree with Jane. Our broker, we've had a few brokers, and the broker, they are very interactive with us. We meet on a quarterly basis. I have a phone call. And then when the renewal comes up, we look at the design of the program. Do we have to change anything? Do we have to do anything? So it's very important that you have a good broker on your side, because if you're just meeting with your broker once a year, renewal time, it's not going to work. It does not work. At Polar several years ago, we have a smoker's plan and a non-smoking plan. So change, people, I'll tell you, when we incorporated the smoking plan because they're paying more for it, they didn't like it. But, what we offer is the smoking cessation classes. Everything that we've offered has been free to the employees to help them change. And maybe some of the employees can't afford this. This is when you go back to your broker, you go back to your insurance company, and go back to the hospital. We have had St. V's Reliant come in and do the luncheon sessions. And I'll tell you, the employees love a free meal. So it does work. But it's very important that you have a broker that works with you, that will look and go through your entire program, because it's very important you work together as a team. And when it comes down to it, the company is paying for all the benefits, the costs. So we always look at the bottom line. And every year, insurance, I don't care what anybody says, one way it is going up 1%. Here, if you've had a good year, 2%. Even if you have a health and wellness program and you've done everything great, and if you're in a smaller company, even a larger company, if you have 2, 3, 4 claims, that's just going to blow everything out of the water, because it could be a very expensive following year.
Yeah, I mean, we spend a lot of time, working with our broker partners, and at the end of the day, what we do is pretty complex. Okay, there's a lot of options that are out there for you to consider as employers, and I think brokers help you understand what's available. You guys have businesses to run, right? Departments to manage. Okay, you can't be experts on everything that's out there in the employee benefit space. And I don't care if it's plan design based, whether or not you're looking at a deductible, what your contribution strategy is going to be, the people that are out there as far as insurance companies, and that's when you need to rely on a good broker. And what you're seeing now is a massive amount of consolidation in the brokerage space, because the demands that are put on the brokers, from wellness to compliance, which I'm assuming we're going to get into a little bit, there's a lot of questions, there's a lot of answers that employers need, and they need to rely on somebody to provide them to them.
Follow-up question. What are the top 3 things that a business should seek from a broker? The top 3 questions that should be answered when they're trying to contract with a broker?
Service, definitely.
Okay.
That is huge. And it's the willingness to be a partner, get to know the organization. I expect a broker to get to know the organization intimately and understand the needs of the organization, and almost be a pipeline on knowledge. Not to discredit Deal, you're saying you go out and find your own information. It's essential, as professionals, that we keep on top of what's happening in healthcare. But brokers are constantly in that marketplace and in that environment. So for me, them to be a resource, them to be a partner, and just to provide the service.
Thank you.
I agree, but the big thing is your broker has to be very knowledgeable today. Look at all the changes with Obamacare coming in. If you get the wrong information and you start working towards a program, it does not help you. So you have to have a broker that is keeping up with the changes to the healthcare, the law changes, and the information that is very important, because I'm not a perfectionist in benefits. I'm a generalist. So when I ask someone from information who is an expert in the field, I expect to get the right question and the right answer.
Okay, question back for Steve and Jane. Do you see your healthcare benefits package as a recruiting or a retention tool? Does your plan help give you a competitive advantage for employees?
Well, I will say from the Crowley family, from Ralph all the way down to our line people, our merchandisers, we all have the same health insurance plan. It has always been a quality plan. Even though our expenses have gone up, the employee co-pays have gone up, they have several options, but the quality is very important to the Crowley family in Polar.
Jane?
At DCU, as at Polar, all employees do have the same benefit package. Our healthcare plan, the cost share is reasonable. I don't know if that's the most popular benefit. I think Free Food Fridays is the most popular benefit, but certainly it is, the complete benefits package is a recruiting tool, but certainly the costs that we have employees pay, the cost share portion, is attractive to them. Many of our roles at DCU are not high-paying positions. They're call center roles. So it's important that we're offering a plan that will cover our employees and can be affordable to them.
Great, thanks. A little bit of follow-on. Do you measure how your healthcare benefits are perceived by employees? If so, how?
Well, we do an employee satisfaction survey, and our benefits package is always up there at the top as one of the reasons that they stay. And even when employees are exiting, we do exit interviews. When we ask what was a real positive at DCU, many times it's the benefits that we offer, from health insurance to all the other ancillary benefits that we offer. But yes, we do measure that and use that as a guide. So when we are discussing what are we going to do for benefits, is there something we can enhance for next year, we get that feedback.
Okay, here's like a question that comes in about 27 parts, so I'll try to narrow it down as best I can. Primarily for Steve and Jane, but for the whole panel. How do you measure success of a health management program for employees? How do you maximize participation? And are there any objections or pushback to those efforts?
At Polar, our broker is very important to us. We do measure, but when we have our meetings, we have our functions, we make it mandatory. We make it mandatory when there are changes. We make it mandatory when we're going to have any change in type of programs or benefits. It's just not come and listen when you can, because down the road, if someone doesn't come to the meeting and they go to a hospital, they go to a doctor, and there's been changes made, they're not happy because they have not gone to the meetings, they do not understand the change. Polar is constantly going through changes, our benefits are constantly going through changes. You have to keep up with the times, we have to keep up with the business. So it's very important to us when we have our meetings, and some people don't like the changes. I've had people at Polar 40, 50 years, and they said, before you came here, we didn't have to pay for our health insurance. So the second year I got there, we started charging $1 for health insurance. So that was huge. But with the educational part, they understand it. But when we have to make changes or different direction on the health care and benefits, it's hard for people to take because they just feel they do not have to pay for it. But it's a slow change, it's an educational change that we as a company constantly drive the costs. And when they ask what their monthly premium is, well, you're paying this, but if you were going to go on COBRA, for a family plan, you'd be paying $1,500 a month. And they said, well, I don't pay that now. I says, no, you don't. So it's the really educational part, letting them know what the information is, and working with them and understanding with them. That's the big thing we try to do at Polar.
DCU, as I mentioned before, our culture would not be that things are mandatory. That's just the culture of DCU. We offer opportunities, annually for employees to meet with our providers, to learn about the programs. It hasn't been done recently, but we're moving back to, giving employees employee benefit statements so they can see the cost of, yes, you might only be paying $50 a week, but what is your employer paying? And so they can see the total value of it. Again, until they see those hard numbers, it doesn't become real to people.
Dave?
Yeah, we have 1,100 employees, 700 of which you can guess what our insurance is as employees. And for the record, our employees don't like deductibles either, right? So, but part of it is that, again, we have a CFO that we answer to and a CEO and a board that looks at the benefit expense, and we deal with the same challenges that our employer groups deal with. And so, a big part of it is the educational piece of it and the employee benefit statements that go out so people understand. We're in a movement to kind of move people more towards a qualified high deductible plan with an HSA. That's been a challenge, right? It requires a lot of education, requires a lot of information. Employees, they have a certain level of expectation. They believe that we're the insurance company, it should be relatively free at this point, but it's not. Right? So a big part of it is making sure that people understand what the benefit is and how the benefit works. And again, even inside of a health insurance company, it's a challenge.
Mike, how does Reliant and its doctors play a role in supporting healthy programs that an employer or an insurer sponsors?
So we do have an occupational medicine department, and we do go out to workplaces, as I mentioned, to do lunch and learns, and we're happy to do that. Most of these are no charge, by the way, so it's a good benefit, I think, for the employers. We also will partner them to look at risk mitigation strategies for reducing workplace injuries. But I think beyond that, our group practice really has a culture of really managing care in the lowest cost of care setting. So I think for employers to partner with a provider group that has that culture, I think is really important. I also don't want to lose sight of the fact that, I think these wellness programs are fantastic, and smoking cessation is key, but I think you can't lose sight of that top, 5 or 10% of folks that, Delia's one slide that showed 15% of employees are driving 75% of all their healthcare costs. That's in line with some national figures where 5% of population drives 50 cents of all the healthcare expenditures in the country. In Massachusetts, it's even more dramatic than that. We have an older population. On average, our commercial population of our patients, which are your employees, are about 4 to 5 years older. New England just has an older aging population because we have a very low birth rate. So with that comes a lot of chronic disease, and those are your expensive employees. So I think identifying them and getting them hooked up with a case manager. We have embedded nurse case managers in all of our primary care sites. For patients that get their care through us, on average, it's 20% lower. Our Blue Cross Blue Shield commercial patients cost their total medical expenses 20 to 25% lower than statewide average. It's very dramatic if you do this kind of work. So, and again, partnering with your payers, I think, can help for the smaller employers out there.
Dave?
Yeah, one quick thing, and Steve, you mentioned it a little bit on the plan that you have and Delia, you talked about data, right? And looking at, providers and where the money's going and things like that, and making sure that you're utilizing efficient providers. And as a large employer, you have access to data. Smaller employers don't necessarily have access to the same information. So what I think is out there is, working again with your broker, looking at what's available in the market, but we use a limited network. Okay, to help drive employees to a very cost-effective provider. Happens to be Reliant, mostly in this area, and CMIPA in Harrington. But I think what it does is it allows small employers access to some of that information to say, okay, look for products and services that drive people to the highest quality, most cost-effective providers. And you can either do that through a limited network, you can do that through a tiered network structure, which is what Polar has. But those are the things that I'd be looking at, right? Because that, at the end of the day, if you listen to Delia, and I think she's spot on, what's going to help over time save the most amount of money?